All right, the first thing you want to do when you come into your room is before you go into your room, you want to check your physician's orders to make sure that it is the right patient and that you're doing the right procedure when you go do your clean dressing change. And then after you go in, you're always going to introduce yourself. My name is Isaac Fowler, and I'm a nursing student, and I will be assisting your nurse today in performing clean dressing change. You're going to check their band and their ID and make sure you have their name and date of birth correctly, and just to confirm that it is the right patient. And then you're going to explain what you're fixing to do to them. You always want to explain what you're about to do. And what we're about to do is we're about to do a clean dressing change. We're going to take out your old dressing, we're going to clean off your wound, and then we're going to apply a new dressing. Now, after you've explained and while you're explaining, you need to be setting up your, gathering all your equipment and setting everything up. This is my work table, and I'm using this paper towel to signify that it is clean here. Always want to make sure that your working environment is clean to where you don't contaminate your dressing or anything that you're putting on there. And you always want to have, this is my waste disposal bag. You always put that at the foot of the bed where you can always just put off anything that you need to dispose of. Next, you're going to have your gauze. I've already peeled them back because this is about the 20th time I've tried to do this video. You're always going to put it under it to make sure that you can get to it easily. Make sure that you've already taken off your bands off your gauze to where you can easily get to them. Have your tape and your solution. Alright, after that you want to get your gloves and start removing the old dressing. When you go to remove your dressing, you always want to make sure that you have loosened it up around so you aren't like ripping it off of the patient or just trying to minimize the amount of damage or any pain that you can cause to the patient. And then you're going to want to scoop it up. And then while you have your when you first take it off, you always want to be able to look at your wound and the drainage in your, especially in your dressing. When you're looking at your old dressing, you want to look at the color and the odor, the amount of how much drainage or anything that is on your old dressing, and you want to also your consistency and how your patient tolerates it, and if there's any pain or if it hurt them when you took off the, like if the wound is tender or anything. And you want to make sure that you document that later in the process. And also you want to be looking at your wound here to be able to see if there's any redness, if there's any edema, if there's you want to make sure you see if the wound is gaping, if it's starting to heal any. You want to see like how wide or how long the wound is, because you're gonna need to document all of those things about the wound, any kind of details that you can find out about it. And you're gonna want to dispose of the old dressing in your bag and change gloves, because what you just dealt with was dirty, and you're fixing to start switching to clean. I'm going to replace my gloves because I'm still dealing with an open wound and I can still contaminate it, so I'm going to change my gloves. The next thing we're going to do is we're going to take our solution and we're going to wet some of our gauze to be able to cleanse the wound. We're going to take our solution and we're going to wet our gauze. I didn't actually mean for water to come out there. We're going to wet our gauze, and we're going to take our gauze and kind of put it in a wonton kind of fashion, like that. And if it's any excessively wet, you can always drain it off. And you're always going to want to, when you're cleaning your wound, you always want to away to close. You always want to go from cleanest to dirtiest, because you don't want to be infecting any of the cleaner parts with anything from the dirtier parts. And you're going to repeat that process, throwing away your used gauze, And you're going to repeat that process about 2 or 3 times, making sure you get closer each time to your wound until you've cleaned it sufficiently. And then you're going to want to take your dry gauze, just a normal dry gauze. Make sure that what you're touching, what the part of the gauze you're touching is not going to be what is touching the patient, because you don't want to be contaminating the wound. So you're going to just pat it dry. You don't want to rub. You just want to pat dry, because if you rubbed, you could be irritating the wound. And you're going to throw that away as well. And then you're going to get your other dry gauze. And once you cleanse your wound, you're going to replace the gauze here, just enough to cover the wound. Again, making sure that none of the gauze that's going to be touching the patient touches you. Just making sure that you only touch the outside of the gauze. And you're going to take, you can just as many as you think can pat it, depending on the size or of the wound, how much that you would need to pat it with. And then you're going to take your tape. And now that you've covered it up and you're not going to be touching any of it, you can take your gloves off. Because it's easier to tape with your gloves off. So you're going to take your tape and just get it about the size of it. You just want to make sure that you can secure it well. You just want to make sure that you secure it. You're going to try to tape all the way around it. Taping over the top of it and on the bottom, and then I'm going to get the other side. And you're going to have a little spot sticking up right here, so I'm going to go across it to make sure that it's down as well. I don't want any part of the dressing sticking out to where it could get snagged in the sheets or something like that. So just make sure it's really secured. And as you can see, I've secured it all across the wound. It is not sticking out in any place. The wound is dry. And just make sure from that point on, make sure that your patient is happy or hasn't hurt any during all of this. And that you want to dispose the rest of your equipment due to your hospital policy. And make sure you leave the patient in a comfortable rails up with their call out and reach. Make sure there's not anything else they need, and then you leave. And then you're going to go and you're going to document all those things you found. As far as you're going to document the color, the consistency, the amount, the odor, and how they tolerated it. And you're going to, any kind of abnormal findings like redness or edema or, gaping wound or any kind of, if it's gotten bigger or smaller. Just want to make sure you document all of those things. And that is it.